Dr. Zaki Morad. I'm chairman of the National Kidney Foundation and also practicing in this hospital here. There's a big concern about chronic kidney disease because the numbers are rising every year. The worst end of chronic kidney disease is what we call end-stage kidney failure. And last year, or 2016, we have about 40,000 patients on dialysis. And the number continues to increase by about 10% a year. The problem is diabetes. So diabetes is the major cause of all patients who are started on dialysis. And as you know, diabetes not only damages the kidney, it damages the eyes, it causes heart disease, it may cause problems in the legs, with ulcers in the leg, which may lead to amputation. So it's a strategy now that we're looking at is to try to control those factors that lead to kidney failure much earlier. For instance, when you been told to have diabetes or high blood pressure, try to make sure they're well controlled. If they are not, then they will start to damage the kidneys. So controlling diabetes and high blood pressure and cholesterol is a very important strategy to prevent or to delay the progression of kidney failure. My advice is if you have an early stage of kidney failure or kidney disease, number one is to ensure that you go for regular checkups, 6 monthly or 4 monthly, and make sure that your kidney function is assessed. But the main thing, if you have high blood pressure, try to keep your high blood pressure below 130/80. The other thing, of course, if you have diabetes as well as high blood pressure, you also have to control your blood sugar. So it's better to start early when you first have diabetes and you have no other symptoms, you're still relatively well, there's the time to control your diabetes, to make sure that all the other organs are not damaged. When we talk about control diabetes, you must try to ensure that your blood sugar in the morning is 6.5 or below if you test your blood sugar at home in the morning. First thing, if you are relatively well with no major problem, is to lead a healthy lifestyle. By healthy lifestyle, I mean number one, you got to keep your weight under control. Try to keep your weight close to your ideal body weight. Number two, try to do exercises. Avoid smoking. Junk food generally is not as healthy as you would like it to be. You know? We take a lot of carbohydrates. Most of our food is quite saltish, and quite a lot of fat in the food that we take. Many are fried stuff. So those are things that we can modify. Supplements, if there are supplements like vitamins and so on, they're quite okay. They're relatively safe. But the biggest worry is that many of these things that are being sold in the market, they say this is good for your kidneys, good for your heart. Some of them may contain many other things that we don't know. For instance, they may have steroids, they may have painkillers inside there, and painkillers, if you take on a long term, can damage the kidneys. So read the label carefully, make sure that it just contains something which is harmless like vitamins, and so on. The National Kidney Foundation, what we're doing now is basically to educate the public. We do a screening test for diabetes, for blood pressure, and then at the same time we use the opportunity to educate them about healthy living, monitoring your kidney function, avoiding foods that may damage the kidney. We provide subsidized dialysis treatment. We've got 26 centers around the whole country providing this treatment.